12 common signs of nerve damage. 1. Pins and needles. One of the most common signs of nerve damage is a tingling, burning or shooting pain in the feet, toes or the hands. This is caused by damage to the peripheral nerves, usually from having high blood sugars. This can also make the hands and feet feel numb or have a loss of sensation. 2. Loss of balance. Some people also have a loss of balance and coordination when they have peripheral nerve damage. Damaged sensory nerves in the feet block the proper signals to your brain, so it can't tell where your feet are. This will make you feel off-balanced, dizzy or unsteady when you walk, also known as vertigo. 3. Lack of tears. If the nerves in the eye become damaged, your eyes can start to become dry and irritated, with sensations of grittiness or burning. You may also become sensitive to light. This type of nerve damage is usually caused by having high blood sugars, which causes microvascular damage to the nerves within your eyes. 4. A loss of smell or taste. There is a nerve behind your sinuses called the olfactory nerve. This is our sensor to aromas and controls our sense of smell. If this nerve becomes damaged, you may lose your ability to smell things properly, or you may experience strange smells. As smell is connected to taste, you may also have problems with recognizing different food flavors. 5. Ringing in the ears. There is another condition called tinnitus, where you hear a high-pitched ringing sound in the ear. This is caused by inflammation or damage to the auditory nerve that transmits sound information from your ear to your brain. This type of nerve damage can also be the cause of vertigo and feeling off balance. 6. Tremors. If you find that your hands, head, trunk or your voice shake without your control, this may be a sign of neuropathy or nerve damage. Essential tremors can often be mistaken for Parkinson's disease, but are actually caused by nerve damage due to a vitamin E or a B12 deficiency. 7. Urinary retention. There are also nerves which control when you pee. High blood sugars or diabetic patients often have nerve damage in this area, which prevents them from releasing all their urine. If you have this, you may need to urinate more frequently or may experience dribbling or painful urination. This can also be caused by a urinary tract infection or an enlarged prostate in men. 8. Over or under sweating. Your nervous system controls how much you sweat. This is a mechanism that your body uses to cool itself and regulate its temperature. The nerves that control sweating, however, are very sensitive to stress, emotions and hormones. So if there is a nerve problem here, you may sweat excessively or you may stop sweating altogether. Vitamin B1 in the form of benfotiamine is very helpful if you have this. 9. Sensation of fullness. If you have problems digesting your food and feel full after just a few bites, you may have autonomic nerve damage. The nerves that control your digestion could be damaged due to nutrient deficiencies. This can prevent the normal pumping action in your colon and also cause problems such as acid reflux and indigestion. 10. Heart palpitations. People with autonomic nerve damage may also feel heart palpitations. These are heartbeats that suddenly become more noticeable, such as a feeling of pounding, fluttering, or irregular beats. This is often caused by a magnesium or a B12 deficiency because these are needed to send electrical messages between the heart and the brain. 11. Anxiety. If you feel that you have racing thoughts, constantly in problem-solving mode, and find it difficult to switch off, you may be suffering with anxiety. Anxiety is a nervous system disorder where you live in a state of fear, panic, nervousness, or restlessness. 12. Sleep apnea. Finally, if your breathing stops and starts whilst you sleep, you likely have damage to your phrenic nerve. The phrenic nerve controls your breathing as the motor control or movement in your diaphragm. This is usually caused by high blood sugars and a vitamin B1 deficiency. What causes nerve damage? Although there are many different triggers that can damage different parts of your nervous system, the most common cause is high blood sugars. Eating sugary foods and refined carbohydrates like bread, cereal, pasta, white rice, sweets and pastries all raise your blood sugars. Over time, these deplete your important nutrients such as vitamin B1, zinc, magnesium, B12 and many others. This weakens your body and makes your nerves much more vulnerable to damage from inflammation. High blood sugar damages the blood vessels connected to your nerves, which then causes them to starve because they can't get enough oxygen or nutrients. Other causes. Nerve damage can also be caused by physical injuries such as a spinal injury. Other causes include vitamin deficiencies, autoimmune diseases, viral infections, drinking too much alcohol, and drugs or medication. 8 steps to repair nerve damage. Now that you're aware of the common symptoms of nerve damage and the underlying causes, you will want to know what steps you can take to start healing your nerves and protecting them from further damage. 1. Cut down on refined carbohydrates, processed foods and sugar. Instead, eat lots of vegetables in the cruciferous family, such as celery, kale, broccoli, cabbage, Brussels sprouts and cauliflower. These foods are rich in minerals like magnesium and potassium, which help to reduce blood sugars and control nerve impulses. 2. Start consuming at least 2 tablespoons of nutritional yeast every single day. This is nature's best source of B vitamins such as B1, B2, B6, etc. B vitamins are absolutely essential to restore your nervous system by fixing microvascular damage. These help to bring nutrients into your nerve cells and reverse many of the symptoms we mentioned today. 3. Take a daily supplement of benfotiamine along with your nutritional yeast. This is a fat-soluble version of vitamin B1 which penetrates deep into your nerve cells in order to heal them from existing damage. 4. If you have any type of nerve damage at all, it's essential that you start eating shellfish at least 3 times per week, such as mussels, clams, crab meat, cockles, shrimp, oysters, etc. These are nature's best source of vitamin B12, which builds the protective coating over your nerves called the myelin sheath. Shellfish are also high in zinc, which restores taste and smell, vision, and other nerve disorders. 5. Remove the stressors from your life. You may need to change your life situation if you have any triggers that are causing you to feel stress and tension on a daily basis. If stress is not of a passing nature, it overburdens your nervous system and causes chemical and structural changes. Take long walks in nature and get lots of B vitamins to help shake off stressful energy. 6. Remove unhealthy vegetable oils like soy, canola, cottonseed and corn oils completely from your diet, as these cause inflammation and damage to your nerves. Switch these out for healthy fats like avocado flesh, extra virgin olive oil, raw coconut oil, grass-fed butter and fatty fish. 7. Lower inflammation in your body by eating lots of foods rich in omega-3 fatty acids, such as fatty fish including salmon, sardines, mackerel and anchovies. Omega-3s provide the raw materials to regenerate and heal damaged nerves. They are also nature's painkillers for relieving all kinds of nerve pain. 8. Finally, if you wish, you can also follow an intermittent fasting plan where you eat all of your calories in a 5-hour window during the day. This triggers the regeneration and repair of nerve cells from high blood sugars or injury.